Well guys, welcome once again to my YouTube channel. My name is Ida Muzati, and a number of you that is via TikTok has been asking me the relationship between contraceptive methods or just family planning methods and hypertension. Now I have an opportunity to speak to a specialist. He is a cardiologist as well as a heart specialist, and we'll just get to see the relationship between high blood pressure and contraceptives. Daktari, thank you for your time.
Thank you so much, Ida.
All right. Sasa, Ebu, just tell us now the relationship between contraceptives or family planning methods generally with hypertension. Yeah.
In general, we have found and it's been documented that hormonal contraceptives, these are tablets that you take every day in injections, tend to actually or be associated with elevated blood pressure. Okay. This is via an indirect mechanism where when you're taking these tablets because they are hormones, they cause an increase in salt and water retention, which leads to high blood pressure. Quite a number of clients, we found that when they're taking the contraceptives or they have the injections, their heart beats a bit faster than usual, they get swelling in their legs, and the blood pressure goes up.
So which contraceptive methods are we talking about? You mentioned of the tablets, any other?
The injections. The tablets, the injections are not as known as the implants, because the implants that can stay there for a year, 3 years, 5 years, all of them are hormone producing. And these hormones are the ones that we're saying cause salt and water retention, and as a result of that, cause high blood pressure.
All right. Now, what can someone do? Yeah, probably your blood sugar is too high, or you are hypertensive, but you still have to be on a family planning methods. What can you do, or what are some of the methods that you can opt for?
Generally, you'll find that when you go for a family planning clinic, they will actually ask you, are you known to be hypertensive? If you are, they are quite unlikely to give you a hormonal method. Or do you have a history of high blood pressure? They're quite unlikely to give you a hormonal method. Sometimes they take a step further and ask if you have a family history of high blood pressure or if you have varicose veins, because all of these things are associated with an increase in high blood pressure. I should hasten to note that there are many people who actually use hormonal methods that don't get high blood pressure, but some do. There are also some hormonal methods, especially the progestin-only pill, that is not shown to show particularly elevated high blood pressure. The ones that have high blood pressure documented is the combined oral contraceptive pill or the injections or the implants.
So I think that is the important bit of us or women not just going to the chemist and picking a family planning method for themselves, but rather going to a specialist for the checkups to be done, and a contraceptive method is prescribed for them. Well, thank you so much, Daktari. Is there any other thing that you want to add? Or you can also tell my viewers where your facility is found.
Know your numbers. We highly recommend that if possible, you check your blood pressure at least once a year if you're less than 30, at least once in 3 months if you're more than 30, and more regularly if you have a history of high blood pressure or a family history of high blood pressure. You can find us at the Heart Rhythm Medical Center. We are located in South Sea at Reliance Hospital, Doctor's Plaza. Karibuni.
All right, thank you so much. Now remember, we were looking at contraceptives or birth control methods or family planning, how they are related to hypertension. Once again, I'm Ida Muzati. We were coming to you from Heart Rhythm Medical Center. As Daktari says it, they are located in South Sea. Thank you once again. Please do not forget to subscribe to my YouTube channel, Ida Muzati.